let's talk about prepatellar bursitis of the knee. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Prepatellar bursitis is something that's not terribly common, but can be really aggravating for the people that have it. What this is a swelling of the bursa in front of the knee. Now you're not going to see it necessarily in this model, but just above the kneecap and the soft tissue that basically goes from the quad tendon over the patella down to the patella tendon, to prevent friction as your knee goes through a range of motion, there's a fluid-filled sac that we all have right on the front of our knees. It's paper thin in most people, so we don't even know it. But maybe you get hit directly on the front of your knee, or you have a job where you're kneeling a lot, like a carpenter or a mechanic. That bursa can get swollen, and you get this big puffy swelling right on the front of your knee. So much that it's really big and swollen and can be uncomfortable. Now, there is a septic bursitis where you can have an infection of that bursa that needs antibiotics or sometimes surgery to clean that out. But what I want to talk about here is just the type that's not infected, where it's a big swollen area and it becomes uncomfortable with direct pressure on it or kneeling, that kind of thing. Sometimes things like ice and anti-inflammatories can get rid of that, and that can be effective. Maybe wearing a knee pad so there's not direct pressure on it as you kneel, if you have to do that a lot for your job. But sometimes that doesn't work. Occasionally, the orthopedic surgeon can go in and draw fluid out. Now that will get some of it out, but a lot of times it comes right back. Or it just doesn't get that much out because that bursa is what we call loculated, where there's a lot of little walls within the bursa, so it's not like one big balloon where all the water would come right out. So that may be something worth trying, but it may not help. Sometimes you can try to draw fluid off and then inject some cortisone, an anti-inflammatory that may help get rid of it. The risk with multiple cortisone shots, though, is that you can actually cause it to get infected, creating that septic bursitis. So some people will do that once, but they may not do it over and over again. If it's just not going away and it's really aggravating, you can do a surgery where you make a small incision and just basically take that entire bursa out. And that typically takes care of the problem. And it's not that difficult of a surgery to overcome because you're allowed to put weight on it and do most of your thing, most of your activities. You just have to get that skin to heal, which is usually not that big of a deal. But surgery can work if it's just not getting better with any non-surgical treatment. Have you had prepatellar bursitis, and how did you get over it? I'd love to hear your experience. I can't give you answers to specific medical questions here, but I'd love to hear your experience. So in the comments below this video, describe your experience so we can all learn from you. Now, I do want to help give you the #1 next thing to do if you're dealing with a knee injury. In the description below this video, there's a link. If you click on it, it'll take you to a page where I ask you 3 or 4 questions. It takes about 15-20 seconds to answer, and that'll help me give you the #1 next thing to either do or know to help you overcome your knee injury. I think it's really helpful, so click on that link in the description below this video. If you like videos like this and you want more information on sports and exercise injuries and injury treatments and injury prevention, subscribe to my video channel. I record several of these videos every single week, so click the subscribe button in the upper right corner of the page. They'll get delivered directly to you. Thank you so much for watching. I really hope this video was helpful if you're dealing with prepatellar bursitis, and I look forward to seeing you right here next time.